Good afternoon. I'm Sherry Thibeault, and I'm here to do a focused assessment on my colleague Teresa on her nose, mouth, throat, and sinuses today. Hi Teresa, how are you today?
Great, how are you?
Good. So before our physical examination, I have already asked her the pertinent health history questions, such as does she have any drainage from her nose, her throat, any pain or tenderness. I've asked her about her history of tobacco use, etc. So before we start here, Teresa, I'm just going to wash my hands.
Okay.
I'm going to start with inspection, external inspection. So I'm looking at her nose. Her nose is symmetrical. It's midline to her face. Her nares are both patent and open. Her septum is in the middle of her nose here. Her lips are nice and moist. There's no lesions or masses noted on the lips. There's no cracking. I'm looking in the area of her frontal and maxillary sinuses. I don't note any swelling there. And also in the area of her submandibular glands, I don't see any swelling there, or in the area of the parotid glands. So next, I'm just going to, if it's okay with you, Teresa, if you let me know if you feel any pain, I'm going to palpate your frontal sinuses. Any pain there?
None at all.
Now I'm going to palpate the maxillary sinuses. Any pain or tenderness there?
No.
Nope. I'm also checking for crepitus. Those, out of the 4 sinuses, those are the only 2 that we can actually physically examine. I'm going to percuss over those areas as well. And we're not actually listening for the sound like we normally would with percussion, but we're seeing if we can elicit any pain or tenderness. Any pain or tenderness
None.
there? Okay. So I'm also going to feel in the area of her parotid gland to see if there's any swelling. I don't note any. Do you have any pain there?
None at all.
In the submandibular, any pain there?
No.
No. Okay. So, Teresa, if you could just take one finger and block one side of your nose and breathe in and out. Okay, and the other? So there's no obstruction notice. Her nares are both patent. If you could just close your eyes for a moment and just let me know what you smell.
Oh, look, almost like a coffee.
Yes,
Yeah.
you can open your eyes. So her olfactory is intact. I'm going to just examine her nose externally, or internally rather, sorry. So I'm just going to hold her head. I'm just going to put this gently, just the tip of it into your nose, Teresa, so that I won't irritate the septum, okay? So I'm just taking a look up there. Okay. So the mucous membranes are pink. The cilia is intact. She's got some clear exudate, which is normal. There's no swelling. There's no lesions. I'm just going to take a look on the other side here. Good. Both look normal. All right, Teresa, I'm just going to put some gloves on here. We're going to inspect the oral cavity.
Okay.
So we're going to start with your mouth. I'm just going to take a look at your gums, okay? So I'm just going to, you can just relax your mouth. I'm just looking, and the mucous membranes are moist. They're pink with some striations. The frenulum's intact. There's no lesions. I'm going to obviously be looking for any oral cancers if they're in there. I'm going to inspect her tongue. If you can stick your tongue out just quickly. Good, you can put it back in. So her tongue protrusion is midline, and I'm just going to take a look at that one more time. You can stick your tongue out, good, and put your tongue up to the roof of your mouth, good. Okay, so I'm looking at the dorsal surface, which is pink. There's no deep fissures, there's no sores, and it's a little bit rough looking, which is normal. The ventral surface, when she put her tongue up, is shiny, it's pink. I'm going to take one more look, Teresa, if you can just bend your head down a little bit for me, because I'm short. Put your tongue up to the roof of your mouth, good. And I'm looking down there at her glands, and I'm looking at the Wharton's ducts from the salivary glands, and there's no signs of infections, there's no sign of obstruction there, okay? I am just gonna, if you can stick out your tongue, I'm gonna be grabbing it with a piece of gauze and inspecting either side of your tongue, okay? Good, good. And the reason I'm looking at both sides of her tongue on the outside is because that's a common area for oral cancer. So we want to make sure that we inspect that. I'm going to now look, if you can open up, and I'm just going to look at the buccal cavities, both sides of her cheeks there, and I'm also at this time eliciting the Stenson's ducts from the parotids, when you push on them, they automatically salivate, which is normal, and I don't see any signs of infections there. The mucous membranes are intact. So if, I'm just gonna look at the hard palate, the
Okay.
soft palate, stick out your tongue. I'm just gonna push down. Okay, can you say ah?
Ah.
Okay, good. So that looks good. The hard palate is a little bit paler. The soft palate is nice and pink. There's no ulcerations or nodules noted. The tonsils are intact, about a 1+. There's no exudate noted. The uvula was midline, and both the soft palate and the uvula did rise symmetrically when she said ah, okay? So when you're looking into the mouth, one of the things you want to note is whether there's any odor. We're also going to inspect the teeth. The teeth have no dental caries. There's no missing teeth, and that's important for nutrition and hydration.
Okay.
But I think everything looks great, and I think you're in great health. Thank you for cooperating.